Ready? Okay, it is 7:30 and Miss Emily Johnson is a 67-year-old female from Pikeville, Kentucky. She is a grandmother of 6 and works part-time at the local library. She has type 1 diabetes and stridor from eating peanuts. Emily also needs a flu shot for this season. On assessment, the nurse can pinch less than an inch. See the healthcare provider orders. So I'm going to go ahead and label Miss Emily. I'll go this way. And there she is. All right. Next, I'm going to go ahead and sit down. Okay. All right. So I'm going to go ahead and compare my physician orders, which I have here, to my MAR. All right. So my patient is Miss Emily Johnson. Her date of birth is 12/16/XXX. Her patient ID is 361806612. And her drug allergies are morphine and codeine. All right, so now the doctor has ordered today for quadrivalent inactivated influenza vaccine, Fluzone, 0.5 mLs IM now. So this is to be given now. So it is 7:30, so it can be given now. Then we have, he says give 5 units of human recumbent HN sub-Q daily, and human recumbent Humulin N 5 units subcutaneous daily. So that matches to be given daily, and it's 7:30 for Emily Johnson. And then epinephrine, Primatene Mist, 1 puff inhalation 3 times a day. So that is the same on the orders, and the MAR at 7:30. Emily Johnson. Boom. All right. So now I've compared my physician's orders to my MAR. So I am gonna get rid of them. Now I'm gonna go over to my Pyxis, and I'm gonna pull out my medications. All right. So first, we're gonna do the quadrivalent inactivated influenza vaccine. All right. So quadrivalent inactivated influenza vaccine, Fluzone injection. It is for Emily Johnson to be given IM now at 7:30. It is 0.5 ml per dose, and it expires 12/30/2050. So it's not expired, and the bottle is intact. So I'm checking, and this is my first med check for this one. Next, I'm giving human recumbent Humulin N. Okay, so human recumbent Humulin N injection. I'm giving 5 units subcutaneously at 7:30. The bottle is unopened, intact, and it expires 12/20/2050. So it's not expired, so it's good to go. First medication check with that one. And then lastly, we're given epinephrine Primatene Mist 1 puff inhalation for Miss Emily Johnson. So Professor Courtney. Professor Courtney. The inhalation is not labeled. Oh, it's labeled on the inside. Oh, I see. Sorry. Thank you. Okay, epinephrine Primatene Mist 1 puff per dose. It expires 12/31/60. This is clean, dry, intact. Looks like it has never been opened before. And that is it's to be given at 7:30 for Emily Johnson through inhalation, and this is my first med check with it. Okay, that's back in there. All right, so now I'm going to do a little bit of med math. So, for my insulin, we are giving 5 units subcutaneously daily at 7:30 for Emily Johnson. So it does not need to do any med math because that's just how the syringe is labeled. For the epinephrine primatine mist 1 puff inhalation for 7:30 for Emily Johnson also does not need to be have med math done because it's just 1 puff of the inhaler. All right, next, I am going to do med math for my influenza vaccine. So okay, so it is the same. It's 0.5 ml per dose and 0.5 ml per dose, but we're just going to write it just to make sure that we have covered everything. So we're giving it in mLs. So this is 0.5 ml for 1 dose. And we're giving 1 dose. So it would be 0.5 ml because it's just multiplied by 1. So 1 times anything is 1. All right, I'm going to do one more check.
So I have my IM injection and my sub-Q injection all ready to go. Now I'm going to go ahead and grab the final medication.
All right, perfect. So everything matches up. We're good to go. I'm going to go ahead and pause that. All right. So now I'm going to prepare my medications.
We're going to be giving the fentanyl 100 mcg topical rounds with 2 8-hours for pain. So I'm going to my fixes. I have it here. Fentanyl 100 mcg patch. Now I have all my medication except for the NUR. More this time. I have all the medications, my patch. I'm gonna grab 2 little Band-Aids right here. Alright, so now I'm going to, I forgot to initial this. Okay, so I am gonna initial that
All right. So first we have the flu vaccine, and this is used to protect her from the flu. Just a normal routine vaccine that's given yearly, and that's also given IM. We have human recombinant insulin injection that is given to lower blood sugar levels in people who are diabetic. And then we have the epinephrine primatine mist, and then this is going to be for her stridor. Okay. So the inhaler is already prepared. I'm just going to prime it when I get to that point of giving it, and also give her some water after.
So before that little guy. Okay. I'm going to get this to him. Okay, so I am going to go ahead and give you your pepper. It's going to be in your belly. and give you a fentanyl patch topically, and then we're also going to give you your influenza vaccine.
Okay, so my bottles are clean. I'm gonna go ahead and prepare for the flu vaccine. I'm gonna take my gloves off because I'm getting in my things. Alright, so since we're giving 0.5 ml, all I'm gonna use is a 1 ml syringe for this. So this is a 1 ml syringe. And since it's being given IM for Emily Johnson at 7:30, M is 3. So we're using a 23 gauge needle. And then for insulin, we always use an insulin syringe. Insulin syringe. Okay, so I'm gonna wash my hands again.
Okay. Okay, come forward there. Alright, so I am going to go ahead and give him his heparin first.
And this glove tore, so we'll get a new one.
So Mr. Smith, I'm going to go ahead and give it to you.
So I don't need to look these up in the drug book also, since I just stated what they're going to be used. Okay, so first we're going to do our flu. And I'm not going to touch the end or the plunger because these are our sterile areas.
Let that air dry.
Perfect. Now I'm going to draw back air of 0.5 ml.
So I'm going to go ahead and pinch right here.
Okay.
Go ahead and
So I have my quadrivalent inactivated influenza vaccine.
Alright, now I'm going to go ahead and pull it out on the skin at the exact same time. Do my one hand recap. Oh wait, I'm sorry. Here we go. So
Okay.
there.
I'm going to do my one-handed recap. And be sure not to touch the top.
Okay, do you feel okay? Yeah? Okay, perfect.
Remove the
Alright, we're going to
bubbles.
go ahead and give the next injection.
And I have 0.5 ml.
No fun pictures.
Okay. And I'm going to go ahead and label it.
Alright, there you go. Hold on. Okay. Now I'm going to go ahead and give him his iron injection. Now, Mr. Smith, we're going to go ahead and do this in your hip and the back spot around it. Okay, so go ahead and lift your drape here and expose your eye.
Not the best tape, but that's alright.
This. Okay. I am assessing the skin. I don't see any areas of redness, no lesions. Does any of this hurt?
Okay.
No? Okay, perfect. Okay, so I'm gonna go ahead and get the little
So we are given
here. We're gonna find the muscle.
quadrivalent inactivated
Actually, do it the other way. Sorry.
flu influenza vaccine. The dosage is 0.5 ml per dose. We are given 0.5 ml IM now, so it's 7:30. My initials and the date. Perfect.
There's the muscle right there. You feel it?
And we're labeling this since we did not prepare it in front of them. So there's that one. I am gonna change my gloves since I was touching my scrubs and everything. Also, wash my hands again. Alright, now I'm going to use my insulin syringe. Alright, so we're giving 5 units.
Now I'm going to go ahead and administer your patch. It's going to be for pain.
So we've got 5 units of air.
So now again, we're going to do fentanyl. I'm sorry, yeah, we're doing the fentanyl, 100 mg topical route, Q8, 3 hours for pain. Mr. Smith, date of birth, 0501, sex, confirming date of birth.
Okay.
Mr. Smith, date of birth, 0501, okay, perfect.
So now, we've made a mistake, and this is why you do 3 med checks. Because this is not insulin. I made the mistake, and that's why we do the 3 med checks. So we're gonna throw this away. See? Yeah. So I don't fail, right, yet?
No,
Oh.
absolutely not.
Bam.
I'm so proud. Like, I can almost cry right now.
Oh my
I'm
gosh.
so proud.
Thank you. Never mind, fans. Followers. I forgot. I'm not in with the hip language.
Mr. Smith, how does that feel for you? Good?
Pretend I changed my gloves, okay? I've changed them already too many times. And I ain't gonna waste Professor Courtney's gloves. So I changed my gloves after I'm getting this other insulin syringe here. Bless my soul. Here we go. We done with that. Now, since this is humulin and recumbent, we're going to turn it to get the concentration that was in the bottom mixed up. You don't want to shake, you want to turn. It is mixed. All right. Oh, gotta do air with this one, boys. Air.
I was waiting for you to tell me
Did I
when you were
forget
done.
something? I think I'm done.
Now you need
All right.
Yay.
One-handed recap. And since this is a high-risk drug, I am going to have my fellow nurse here check that I have 5 units for subcutaneously of humulin recumbent for Miss Emily Johnson. Fellow nurse, would you care to do a check for me?
I'm doing a check, and yep, looks good. That is 5 units.
Perfect. Trapper, make sure we got all the bubbles out. We're also done with this now. All right, now we're gonna label. So we are given human recumbent.
So like nicely, but as soon as I started talking to him and trying to put it in a stealth voice, he's like, no.
Cumulant in,
I just,
we're given 5 units.
say we say.
My initials are SF. We're giving it to him now at 0730, and it's 10:29.
Night, so I can only practice on him on the weekend, so he does. And a cat.
And that.
The cat's a little more compliant.
Thank you so much.
All right, now
No, thanks.
we're gonna remove our gloves, do our second med check.
Any band-aids needed? Oh, when you take off.
Oh, yeah, I'm sorry.
We know we gave
Let me know if you have
the
any
right
issues uploading, but I'm hoping
medicines in the syringes, but
within
so first we're giving quadrivalent inactivated influenza vaccine, Fluzone,
they're having the most trouble.
0.5 ml. We're giving it IM at 7:30 to Miss Emily Johnson. And here it is.
Get on Wi-Fi and then try and like see if I do that. Cool.
Perfect. So there's that one.
Thank you all so
So
much.
then we're giving human recumbent, cumulant in. We're giving 5 units subcutaneously at 7:30 to Miss Emily Johnson. Okay, lastly, we're given epinephrine Primatin mist 1 puff inhalation at 7:30 to Miss Emily Johnson. All right, so now I'm going to gather my supplies before I go in the room. I would wash my hands before I go in the room as well. So I'm going to need some
No. Oh, okay.
2x2s.
Oh, okay.
I'm going to need some gauze pads. I'm going to take a couple extra just in case. I'm going to need a Band-Aid for my IM injection. And that's all I need. So I've got my MAR, my flu vaccine, my insulin, my inhaler, my 2x2s, my Band-Aid, and my gauze. All right, here we go, Miss Emily. All right.
Come in.
Hi, Miss Emily. How are you doing today?
I'm okay.
All right. Well, my name is Sydney, and I am going to be your student nurse for the day, okay?
Okay.
All right. So I'm checking out the environment for the patient, and it is clear. All right, Miss Emily. How are you feeling today?
I'm okay.
No pain today?
No pain.
All right. Well, we've got a few medications to give you here today. But first, could you tell me where you are today?
I'm in the hospital.
Okay. Could you tell me why you're here?
I'm sick.
Okay. Could you tell me what day of the week it is?
It's Friday.
Okay. Are you familiar with University of Kentucky?
Yes, ma'am.
Could you tell me what the mascot is?
A wildcat.
Well, perfect. So the patient is conscious and oriented ×4. All right, so I'm going to go ahead and lay my supplies down here. All right, Miss Emily. I am going to go ahead and check your name and date of birth. Can you tell me your name?
Emily Johnson.
All right, and your so your name's Emily Johnson. Your date of birth?
12/16/XXX.
12/16/XXX. That is correct. I'm also going to check your patient ID, which is 316806612. So that matches. All right, Miss Emily. I have down here you're allergic to morphine and codeine. Is that correct?
Yes, ma'am.
Okay. Well, all the medications we're going to give you today, none of that is in there.
Good.
We are going to give you the flu vaccine, which is just something you should get yearly. Is that okay with you?
Yes.
Are you familiar with that?
Yes, ma'am.
All right. I also have down here, we're going to give you some insulin. Do you usually take that?
Yes, ma'am.
So you're familiar with that?
Yes, ma'am.
All right. And then I know they said you're having some stridor and from eating some peanuts. So we're going to give you, are you having a little trouble breathing?
A little bit.
Okay, so we're going to give you a Primatine epinephrine puff from this inhaler here just to help you breathe a little better, okay?
Okay.
All right. I'm going to go ahead and wash my hands. ahead and listen to your lungs real quick, if that's okay?
Yeah.
Just before we give you this inhaler, okay?
Yes, ma'am.
All right, perfect. Well, I'm just going to listen, so I don't need no gloves, just listen.
Mm-mm.
So I'm going to go ahead and clean my stethoscope. I'm going to clean down here first. I cleaned up there first, but probably not. All right, Miss Emily. I'm also going to lift her up to a good working height since I'm a tall gal. See, these is y'all things here. All right. Excuse me, Miss Emily. Okay. I'm just gonna have to expose your chest, Miss Emily, so I can listen to your lung sounds. Is that okay with you? Miss Emily?
Yes, ma'am.
I'm the nursing supervisor, and I need to give this IV
Okay.
because with COVID, we're running out of IV pumps.
Oh,
we
that
have
is
to
so
get this
fine.
for this student. I'm
She's just
so
my
sorry.
supervisor, Miss Emily. She's here to watch me.
Sorry.
Okay. Well, you better do good.
Okay. All right. Just take a deep breath for me. Deep breath. Oh my. Oh my. Miss Emily,
They said I got that strider.
I'm telling you. Continue. Another one. Another one. Another one. All right. One over here, please. Okay. One over here, please. Okay. Oh, gee. One over here. Okay. One over here. Okay. All right, ma'am. I'm going to sit you up a little here so I can listen on your back. I'm going to pull your shirt up. Is that okay?
Yes, ma'am.
All right. Okay, over here. Uh-huh. Uh-huh. I'm not going to make my friend do this, but just know I would listen about 8 or 9 different spots bilaterally on the back, okay?
Thank you. My throat's getting scratchy.
I know. All right, Miss Emily. Lord, honey, come on. Sounds like you do have some bad stridor there.
Yes, ma'am.
Okay. Well, we're going to go ahead and give you this inhaler here, okay? I don't have to have gloves for the inhaler, and I can't give the inhaler, so I'm just going to instruct the patient how to do it. So we will pop this cap off here.
This is how I have everything set up. And
We would prime it with 1 to 4 squirts to prime it if it's never been used, all that stuff. If it has been used, it doesn't need to be primed. So what we would do is just give Miss Emily 1 squirt, 1 inhalation. I would have her inhale deeply, hold her breath for 6 seconds, and then exhale. There's that. And then I would also have water on hand to offer her in case she's getting choked or anything like that. Okay, and that's the inhaler. All right. Miss Emily, I'm going to go ahead and give you your insulin injection. Is that okay?
Yes, ma'am.
Okay. We'll reassess your lung sounds in just a moment
Okay.
and see how that's working.
that's your tubing. Also, you've got me again, so you absolutely can do an IM injection and sub-Q injection on these, so make sure that you do it.
because we got that hand thing and it's rough.
So you'll just turn to the camera
Alright.
and we'll talk about how you just take the Yeah, you, I mean, you can, you absolutely can. It just, don't even open it.
All right, Miss Emily. I was also supposed to do my third med check by the bedside.
Won't even, take the time to open it.
Correct
But,
myself.
you know, you'll run the if you.
So I was given epinephrine Primamist 1 puff inhalation at 7:30 to Miss Emily Johnson, whose birth date is 12/16/XXX. Allergic to morphine and codeine. And that matches. Now I'm gonna, third med check. So now I'm gonna do my third med check for my insulin here. So Miss Emily, we are giving you human recumbent, Humulin in 5 units of insulin today for Emily Johnson at 7:30. And that is all correct. So that's good for third med check with that one. We'll just go ahead and do this one just so we don't forget. We're going to do the quadrivalent inactivated influenza vaccine. Oh, that was given subcutaneously. This one's going to be 0.5 ml IM. Now, at 7:30 for Miss Emily Johnson, whose birthday is 12/16/XXX. All right, Miss Emily, I'm going to expose your belly. We're going to give it to you there. Is that okay?
Yes, ma'am.
All right, perfect. So what I'm going to do is give it to her free, or 2 inches away from the umbilicus. And so it also says that on the assessment, the nurse can only pinch, she can pinch less than an inch. So if it was 2 inches, we give it at 90, but since it's less than an inch, we're going to give it at a 45-degree angle.
If you want your videographer to step forward, if you want your coach them, whatever you want to do, just communicate with them, because it's your assessment, you're going to make sure I can do anything.
Okay?
Okay?
So we would do a 2-inch diameter, cleaning it very well.
Oh, you can just say it, okay.
All right.
Okay, any other questions?
We would let this dry now, but it probably won't. I'm gonna go ahead and get my tuba-tubes ready, and I've got my injection ready. All right, Miss Emily, are you ready?
Yes, ma'am.
Okay. So we're pinching less than an inch, so we're giving it a 45-degree angle instead of 90. Okay, ready? 1, 2, 3. All right. We have recapped our syringe. We have put gauze on it. We're gonna throw this away. All right, Miss Emily, are you feeling okay?
I'm good.
Okay. How's your breathing? Is it getting better?
Oh, honey, yeah, it's a lot better.
Okay, good. All right. Now we're gonna give you your IM injection, and we're gonna do your vastus lateralis. So we're gonna do it on your leg. Is that okay?
Yes, ma'am.
All right. I'm just gonna expose your bottom here.
Okay,
We might have to turn you around.
that's okay.
All right. We're gonna flip you around here.
Okay. Little roller coaster ride.
Yeah. All right. So I'm gonna go ahead and get my Band-Aid ready.
Yep.
And that way I can just stick her straight on. All right, Miss Emily. You ready?
Yes, ma'am.
Okay. Let's clean you up here. All right. So we're gonna go at the hip, and it's supposed to be at the knee. And we're gonna go right in between in the muscle part.
Beautiful.
We're gonna do clean it, about 2-inch diameter circle. And we would let that dry, but I'm gonna also leave that there so I can see my site. I'm also gonna get my gauze ready, so I'm ready to go. All right, Miss Emily, are you ready?
Yes, ma'am.
Okay. Ready?
Yes,
so
ma'am.
I'm going to Z-track by pulling the skin back. Gonna go at a 90-degree angle. Ready?
Yes, ma'am.
1, 2, 3.
Ow.
Yeah, that's a big one. How you doing?
Oh, honey, I'm good.
You did a real good job.
Thank you.
You're welcome. We're gonna go ahead and stick his Band-Aid on you, okay?
All right. You couldn't have found me a Minnie Mouse one?
Sadly, no.
Okay.
I would prefer it myself, to be honest with you. I have some Disney princess right at home. All right, Miss Emily. Also, none of the skin was irritated. If any of the skin would have been irritated, I would not have given these injections to her, or I would have found a different site. Also, for the insulin injection, I would have asked her where her last one was. That way I wouldn't have given it in the exact same spot. All right, Miss Emily. How are you feeling?
I'm good, honey.
You're good? Okay. Let me assess them lungs real quick, okay?
Okay.
So I just used it. I would clean my stethoscope since it had been on my scrubs, because that is nasty.
And nasty.
All right, Miss Emily, I'm going to have to expose your chest again a little here, okay?
All right, honey.
So I would listen to 6 sounds on the front, 2 on each side, and I would go bilaterally instead of down.
Yes,
I would
ma'am.
also listen to 8 or 9 sights bilaterally on the back. Gosh, Miss Emily, your lungs sound a lot clearer than they did.
Honey, I know. I feel a lot clearer.
Okay. Well, I'm going to go ahead and clean up my space here.
Okay.
All right.
I can't answer that question. I'm sorry.
I'll go ahead and cover you back over.
Okay.
All right, ma'am. Well, I'll come back and reassess you in about 15 to 30 minutes. Your call light's in reach. I am going to lower your bed back down since I ain't working on you now. All right, your call light's in reach. Everything looks good. Do you need anything right now?
No, honey, not at all.
Okay. Well, I'm gonna skedaddle.
All right.
I'll put your table back over here. All right. Well, thank you so much, Miss Emily. And I
Thank
provided
you.
for privacy because I closed that door when I came in.
Yes, ma'am, you did.
All right. Thank you so much.